Thank you for joining us for this presentation of the 2026 Health Plan Comparison. We want to help you understand how to better use the plans to fit you and your family's needs. During this presentation, we will discuss the two health plan options we will be continuing for plan year 2026. They are the Consumer-Driven Health Plan, or CDHP, and the Point of Service, or POS plan. And we will do a comparison of the two plans where we will explain the plan similarities and differences, as well as the plan services and features. The first important point to remember is that we will continue to offer the same two plans in 2026. First, the Point of Service, or POS plan, allows you to choose in or out of network care and services anytime. Second, the Consumer-Driven Health Plan, or CDHP, also allows you to choose in or out of network care and services anytime, and if enrolled, it allows you to use a health savings account, or HSA, to pay a wide array of eligible healthcare expenses directly. Eligibility rules do apply for the HSA. With the Consumer-Driven Health Plan, you will be more cost-conscious when utilizing services. Both plans permit you to decide how, when, and who will be managing your healthcare needs. We will dive more into their design a little later in this presentation. Let's review the similarities, or what is the same, about both plans. To start, it's the allowed amount. The allowed amount is a negotiated fee Sentara health plans and participating providers, facilities, including those in the PHCS/multi-plan providers network, agree to accept for services covered by Sentara health plans. Meet Janice Jones. She's enrolled in the POS plan. Janice was wondering how much her cost would be if she were seen by her primary care physician, or PCP. The negotiated rate is the discounted amount providers charge Sentara members for this service. In this example, you can see that the amount her provider normally charges for an office visit is $275. For an office visit, the allowed amount would be $159. Of this $159, Virginia Beach City Public Schools would pay approximately $136, leaving Janice responsible for paying her $20 copay. That's a savings of $115. In addition to negotiated fees, both plans also cover 100% of the cost of preventive services. Listed here are some of the services considered to be preventive and covered at 100% by Sentara health plans, meaning you are not charged for them. Also listed are preventive pharmacy services, which are not subject to the deductible. This list is not all-inclusive. I want to briefly highlight some key components of a routine annual physical exam. An annual physical is when you see your PCP to review your health history, get lab work done, and it is a physical examination to determine the general status of your overall health. It gives you a chance to talk to your doctor about how you're doing generally. Now, I want to make you aware that during your physical exam, if you want your doctor to treat you for a specific symptom, maybe you're having neck pain and soreness in your throat that is getting worse, if you have it diagnosed or additional lab work or x-rays are needed, the visit would no longer be considered preventive, and you would be responsible for any copay or co-insurance costs of the visit. What began as your annual physical exam has now become a diagnostic visit, and the same would apply to any lab work or x-rays done during the visit. We want you to be aware of this so that you understand how to use your health plan services effectively. Getting back to the similarities, you will have access to the same network of physicians on both plans. The network of physicians includes the Sentara Health Network, which is a regional network that includes all area hospital systems, the PHCS Network/Multiplan Network, which is a nationwide network of physicians where members have access to a wide network of practitioners, hospitals, and other facilities across the country. The Sentara Quality Care Network, or CQUN, which is a network of doctors and facilities who deliver services focused on quality, performance, efficiency, and value to the patient. And the MD Live Virtual Care Network provides you with board-certified doctors and therapists that are just a phone call, mouse click, or finger tap away. The last of the similarities I want to highlight is that both plans will provide the same high-quality coverage for the same services. It is important to remember, as neither plan is better or worse than the other. However, the out-of-pocket costs at the time you receive services will be different between the plans, and we will review this shortly. This presentation captures a short version of covered services. A full summary of benefits for both plans is available on the CBO website at www.benefitsatthebeach.com. If you're enrolled in Sentara health plans with the City of Virginia Beach or Virginia Beach City Public Schools, you have access to various case management programs. These programs are dedicated to learning about your specific needs and will provide you with guidance, support, and education. The following programs are available: diabetes disease management, respiratory disease management, cardiovascular disease management, and rare chronic disease management. For additional information, you can view your summary of benefits at www.benefitsatthebeach.com. Both plans will include vision care as part of the health plan benefit. Taking care of your eyes is just as important as getting your annual checkups. As you can see from this chart, VSP Vision Care offers employees an annual comprehensive eye exam with in-network coverage for a copay. It also provides up to $150 benefit for frames and/or contact lenses. Both plans provide the same prescription drug coverage and pharmacy providers. The first is by using our preferred pharmacies, which are Walgreens, Walmart, and Sam's Club, just to list a few. You will be able to get up to a 90-day supply at preferred pharmacies. You may visit any retail pharmacy. However, the co-pays/coinsurance are less at the preferred pharmacy. Express Scripts home delivery is also available and a great option for maintenance medications, such as for high blood pressure and cholesterol. Your medication may cost less, and you will get refill reminders when signing up for home delivery. You also have access to the specialty pharmacy with Proprium for any unique or complex prescription needs, and a home delivery for a 30-day supply is available. Now, let's discuss the differences between the CDHP and POS plans. There are 3 important differences that we will need to discuss more in detail. First, the plans have different eligibility for pairing with the health savings account. Second, what you will pay in premiums is different between the plans. And third, what you will pay at the time you receive services will be different between the 2 plans. The CDHP will allow you to also participate in a health savings account, or HSA, if you meet the eligibility requirements. With the point of service plan, POS, you will not be able to participate in an HSA. The greatest benefit to the CDHP is that if eligible, the city and schools contribute prorated payments towards a health savings account for you, $750 for subscriber-only coverage and $1,250 for all other coverage tiers. You do not need to contribute to the health savings account to receive the employer contribution. The next difference I want to highlight is the difference in premiums between the CDHP and POS plans. This slide will show the 2026 active city/school rates for those receiving employer contribution. The employer contribution is the amount that the city and schools contribute towards your health plan coverage. I would like to bring your attention to the employee premiums for the CDHP plan. As you can see, they are lower than those for the POS plan. We encourage those who enroll in the CDHP to enroll in the health savings account in order to receive the HSA employer contribution. For city employees, there are no changes to health plan premiums. However, please note that health plan premiums will now be deducted over 24 pay periods in 2026, previously 26 pay periods. This slide will show the 2026 retiree city/school rates for those receiving the employer contribution. Retirees receiving the employer contribution are hired before July 1st, 2014, and are city and school retirees who retired with 25 or more years of combined cumulative service from the city or schools, or city retirees who retired with 5 years of service with a job-related disability. This slide will show the 2026 retiree city/school rates for those not receiving the employer contribution. Those not receiving the employer contribution are hired before July 1st, 2014, and are city and school retirees who retired with less than 25 years of combined cumulative service from the city/schools, or city retirees who retired with less than 5 years with a job-related disability from the city. The last difference I want to highlight is the difference in what you pay at the time you receive services between the CDHP and POS plans. Deductibles for the CDHP are a little different than the POS plan. The CDHP is a high-deductible health plan that allows a health savings account to be integrated with it, and as such, it requires that all services are paid for by the member until the deductible has been met, except for preventive services. As you can see from this chart, the deductible for the CDHP plan is $2,000 for an individual and $4,000 for a family. Another difference is referred to as a non-embedded deductible. I'll explain. Non-embedded means that you must meet the family deductible / out-of-pocket max if enrolled in any tier other than subscriber only. With CDHP, if you are enrolled in subscriber-only coverage, you will pay for services up to $2,000 before the plan begins to pay. However, If you are in any other tier with dependents, such as subscriber plus child or children, subscriber plus spouse, or family, you must meet the family deductible amount of $4,000 before the plan will begin to share in the cost of services. The plan will not begin to pay when one member reaches the individual deductible amount of $2,000 if the family has not met the $4,000 family deductible. Again, this is referred to as a non-embedded deductible. However, a few things to keep in mind. As always, preventive services are covered at 100% before the deductible has been met. The CDHP features lower premiums compared to the POS plan. Because there are no services covered before the deductible on the CDHP, any payments you make for covered services count towards meeting the deductible, except vision. Now, showing on your screen is a summary of the plan features for the CDHP. It does not show all the services the plan covers. However, it displays some frequently used services that will be good as an illustration. Always reference the summary of benefits for this plan located on www.benefitsatthebeach.com. Let's move on to the POS plan. A deductible is the amount you must pay out of pocket for covered services, except for in-network preventive care services or other services shown in the summary of benefits as covered without a deductible. Here's an example. Let's say there are 3 individuals on the plan this time. Family member number 1 pays $850 for services out of pocket. They have met the individual deductible, and the member will begin to pay the applicable copay or co-insurance for the remainder of the plan year. This is referred to as an embedded deductible, meaning that if one family member meets the individual deductible of $850, their benefits will begin, and they will pay the appropriate copay or co-insurance. An example of the family deductible being met is if there are 4 family members on a plan and the family member number 1 paid $700 towards services out of pocket. Family member number 2 paid $600, and family member number 3 paid $400. Your family will have met the family deductible for the POS plan of $1,700. For services that occur after this point, the member will begin to pay co-insurance for services received by all members, even though the $850 individual deductible amount has not been reached by a single family member. Under the POS plan, there are a few services you will only pay the copayment for and will not have to pay towards or have met your deductible amount. You'll see on the screen that these services have a superscript 1 next to them and include PCP specialists, maternity care, and pharmacies. Tiers 1 and 2 are copay, Tier 3 is co-insurance. Now you have heard me talk about copays and co-insurance. So what is that? A copay is a flat dollar amount, like $20, that you pay for certain services under the POS plan at the time of service. Co-insurance is a percentage of the total allowable amount or negotiated fee. So if the plan pays 85%, you will pay 15%. Remember, you can get in-network preventive care covered at 100% without having to pay anything towards your deductible when not considered diagnostic. Under the POS plan, an individual would pay the first $850 for in-network services unless there is a copay. After you meet your deductible, the plan would then begin to share the costs of those services. You will see a superscript AD next to these services on your summary of benefits. Most services on the POS plan are covered at 85% after you meet the deductible. The family deductible under the POS plan is $1,700. Each family member will pay the first $850 for services that do not have copay/co-insurance until the family has reached the $1,700 family deductible. For example, if enrolled in subscriber plus spouse, both individuals would have to pay the first $850. $850 times 2 is $1,700. However, for 3 or more individuals on a family plan, as soon as the combination of family members have paid the first $1,700, the plan will then begin to pay the co-insurance for any family member on the plan having services. I want to highlight a few more points to remember about the deductible if you choose to enroll in the POS plan. Any amount you pay for services will count towards meeting your deductible, except for co-payments for PCP, specialist, and maternity care visits, and pharmacy copays. You will continue to be responsible for making the co-payments for these visits even after meeting your annual deductible. Last note about the deductible, payments for out-of-network services are accounted for separately and count towards your out-of-network deductible. Before I end, I want to talk briefly about maximum out-of-pocket, or MOOP. Both plans have maximum out-of-pocket amounts, and this is the most you would have to pay for healthcare services in a calendar year, so you are protected from catastrophic healthcare costs. If you have any questions regarding the health plans and/or the health savings account, please note the contact information on the screen as well as the Consolidated Benefits Office information. We are only a phone call or email away. I hope that with this presentation, you have a better understanding of the two health plans offered so that you can make an informed decision about which plan is best for you and your covered dependents. Thank you for your time and attention. And don't forget, we are here to help you with your benefits at the beach.